My name is Engineer Joe Joseph, and I am working as a safety engineer in our hospital. The use of chemicals in healthcare settings is both essential and potentially hazardous, making it crucial for us to understand and adhere to strict safety protocols. In our daily operations, we encounter a variety of chemicals from cleaning agents to disinfectants and even pharmaceuticals. While these substances are integral to maintaining a sterile and functional environment, they also pose risks if not handled correctly. Improper use, storage, or disposal of chemicals can lead to serious injuries, health complications, and environmental damage. Your attention to these safety measures is not only a professional responsibility but also a commitment to the health and safety of our patients, colleagues, and the broader community. Let's work together to maintain the highest standards of chemical safety in our hospital. Thank you for your dedication and cooperation. These are the training outline. 1. Introduction. 2. What is hazmat? 3. MSDS or SDS. 4. Chemical spill management. 5. Hazardous materials labeling. Introduction for the chemical safety in our hospital. Chemical safety in hospitals is critical to ensuring a safe environment for patients, healthcare workers, and visitors. Hospitals use a variety of chemicals, from disinfectants and sterilants to pharmaceuticals and laboratory reagents, all of which can pose significant risks if not properly managed. An effective chemical safety program in a hospital includes identifying hazardous chemicals, implementing proper storage and handling practices, providing comprehensive training for staff, and establishing protocols for emergency response in case of spills or exposures. By prioritizing chemical safety, hospitals can prevent accidents, reduce health risks, and maintain a secure and compliant healthcare setting. What is hazardous materials? Hazmat. Hazardous materials are substances that poses physical, fire or explosion, or health hazards or product that can harm human health or environment if improperly handled. Hazardous materials can be chemical, radioactive, or biological. It can be in many forms such as liquid, solid, or gas, which has one thing in common: they have harmful effects on humans and the environment. What is MSDS or SDS? The terms Material Safety Data Sheet (MSDS) and Safety Data Sheet (SDS) both refer to documents that provide detailed information about the properties, hazards, and safe handling of chemical substances. The primary difference between a Material Safety Data Sheet (MSDS) and a Safety Data Sheet (SDS) lies in their format and regulatory framework. MSDS was used primarily before the adoption of the Globally Harmonized System (GHS) and lacked a standardized format, leading to inconsistencies in the presentation of chemical safety information. In contrast, SDS, introduced under the GHS, follows a globally standardized 16-section format that ensures consistency, clarity, and comprehensibility across different regions and industries. The shift from MSDS to SDS reflects an international effort to harmonize chemical safety information, making it easier to understand and manage worldwide. Purpose of MSDS/SDS. An MSDS, Material Safety Data Sheet, or SDS, Safety Data Sheet, is a document that provides detailed information about the properties, hazards, safe handling, and emergency measures related to a chemical substance. It includes critical data such as first aid procedures, firefighting methods, storage guidelines, and exposure controls. The SDS, which follows a standardized 16-section format under the Globally Harmonized System (GHS), ensures that this information is consistently presented worldwide, enhancing safety and regulatory compliance across industries. Whether referred to as MSDS or SDS, the document is essential for ensuring the safe use of chemicals. When would you use MSDS? Always be familiar with the hazards of a product before you start using it. You should look at a MSDS, match the name of the chemical on your container to the one on the MSDS, know the hazards, understand safe handling and storage instructions, as well as understand what to do in an emergency. How to refer or understand MSDS/SDS. There are 16 sections in the MSDS or SDS. Section 1 Identification, Section 2 Hazard Identification, Section 3 Composition/Ingredients, Section 4 First Aid Measures, Section 5 Firefighting Measures, Section 6 Accidental Release Measures, Section 7 Handling and Storage, Section 8 Exposure Controls/Personal Protection, Section 9 Physical and Chemical Properties, Section 10 Stability and Reactivity, Section 11 Toxicological Information, Section 12 Ecological Information, Section 13 Disposal Considerations, Section 14 Transport Information, Section 15 Regulatory Information, Section 16 Other Information. Example: here you can see the MSDs of povidone iodine. Now we'll understand each sections one by one deeply. Section 1 Identification. Product Identifier. Product Identifier: the name of the chemical as it appears on the label or in the workplace. This could include the chemical name, trade name, or product code. Manufacturer or supplier details. Information about the company that produces or supplies the chemical, including company name, address, phone number, emergency contact number, recommended use. A brief description of the intended or recommended uses of the chemical, such as used as a cleaning agent or for industrial use only. Restrictions on use. Any specific uses that are not recommended, often due to safety concerns or regulations. For example, not for use in food preparation areas. Importance. This section is crucial as it serves as the first point of reference for anyone handling the chemical, providing the basic details needed to understand what the product is, who to contact in case of an emergency, and how it should be used safely. Section 2 Composition and Information on Ingredients. This section provides detailed information about the chemical composition of the product, including the identification of any hazardous ingredients. Substance or mixture indicates whether the product is a single substance or a mixture of multiple ingredients. Chemical name: the scientific name of each ingredient in the product, especially those that are hazardous. Common name or synonyms: any other names by which the chemical or its components are known. CAS number: the Chemical Abstracts Service (CAS) registry number, a unique numerical identifier for each chemical substance. Concentration or concentration ranges: the percentage or concentration range of each hazardous ingredient in the product. Classification of ingredients: details on how each ingredient is classified in terms of its health, physical, and environmental hazards according to relevant regulations such as GHS. Section 3 Hazards Identification. This section outlines the potential hazards associated with the chemical, including its classification according to regulatory standards. It provides essential information on how the chemical can affect health, safety, and the environment, helping users understand the risks involved. Classification of the substance or mixture describes how the chemical is classified under relevant regulations, such as the Globally Harmonized System of Classification and Labeling of Chemicals (GHS). Hazard statements: standardized phrases describing the nature and degree of the hazard. Potential health effects: a description of the health effects that might result from exposure to the chemical. Unknown acute toxicity: if a percentage of the mixture is composed of ingredients with unknown acute toxicity, this must be stated. Any other specific hazards not covered by the classification, such as may cause long-lasting harmful effects to aquatic life. Section 4 First Aid Measures. This section provides essential instructions for administering first aid in case of exposure to the chemical. It outlines specific steps for treating different types of exposure, such as inhalation, skin contact, eye contact, or ingestion. The section also includes information on the most important symptoms or effects, both acute and delayed, that may result from exposure. Additionally, it advises on whether immediate medical attention or special treatment is required, ensuring that responders can act quickly and effectively in an emergency. This information is crucial for minimizing the impact of exposure and ensuring proper care is provided promptly. Section 5 Firefighting Measures. This section provides crucial guidance for safely and effectively responding to fires involving the chemical. It details suitable extinguishing media, such as water, foam, or dry chemicals, and highlights any specific methods or precautions that should be taken during firefighting. Additionally, it describes potential hazards that may arise in a fire, such as the release of toxic fumes or explosive reactions. Firefighters are also informed of any special protective equipment required. like full protective gear and self-contained breathing apparatus. This information is vital for ensuring that fires are handled safely while minimizing risks to personnel and property. Section 6. Accidental Release Measures. This section outlines the procedures for safely managing spills, leaks, or accidental releases of the chemical. It includes recommendations for personal precautions, such as wearing appropriate protective equipment to avoid exposure, and environmental precautions to prevent contamination of water sources or soil. The section also provides instructions for containment and cleanup methods, such as using absorbent materials, ensuring proper ventilation, and disposing of waste in accordance with local regulations. These measures are essential for minimizing health risks, preventing environmental damage, and ensuring a swift and safe response to accidental releases. Section 7. Handling and Storage. This section provides guidelines for the safe handling and storage of the chemical to prevent accidents, exposure, and environmental contamination. It includes advice on handling practices, such as using protective equipment, avoiding contact with incompatible substances, and ensuring proper ventilation. Additionally, it outlines storage requirements, including ideal temperature ranges, humidity levels, and specific conditions like keeping the chemical away from heat sources or direct sunlight. The section may also highlight any special requirements for containers or packaging. These guidelines are crucial for maintaining safety in the workplace and prolonging the stability and effectiveness of the chemical. Section 8. Exposure Controls / Personal Protection. This section provides critical information on how to protect workers from hazardous exposure to the chemical. It includes recommended exposure limits, such as occupational exposure limits, OELs, threshold limit values, TLVs, or permissible exposure limits, PELs. The section outlines engineering controls like ventilation systems to minimize exposure and specifies the necessary personal protective equipment, PPE, such as gloves, goggles, respirators, or protective clothing. It may also provide guidance on hygiene measures, like washing hands after handling the chemical and avoiding eating or drinking in areas where the chemical is used. These controls and protective measures are essential for ensuring a safe working environment and protecting the health of those handling the chemical. Section 9. Physical and Chemical Properties. This section details the fundamental physical and chemical characteristics of the chemical, which are crucial for understanding its behavior and handling requirements. It includes information such as the chemical's appearance, color, state, odor, pH level, melting and boiling points, flash point, evaporation rate, flammability limits, vapor pressure, density, and solubility in water. Additionally, it may provide details on other properties like viscosity and stability. Understanding these properties helps in assessing the chemical's risks, determining appropriate storage conditions, and implementing safe handling procedures. Section 10. Stability and Reactivity. This section provides information on the chemical's stability under normal conditions and its potential reactivity with other substances. It details conditions to avoid, such as extreme temperatures, moisture, or incompatible materials, which could lead to hazardous reactions. The section also describes any known hazards related to the chemical's instability, such as the potential for explosions, polymerization, or the release of toxic gases. It may include information on hazardous decomposition products that could form under certain conditions. Understanding these factors is essential for safe storage, handling, and preventing accidental reactions that could pose safety risks. Section 11. Toxicological Information. This section provides an overview of the chemical's potential health effects based on toxicological data. It includes information on acute and chronic toxicity, detailing how exposure can affect various organs and systems, such as the respiratory system, skin, eyes, or gastrointestinal tract. The section covers symptoms of exposure, including immediate effects like irritation or poisoning, as well as long-term health impacts such as cancer or reproductive effects. It may also provide information on the chemical's potential for causing sensitization or allergies. This data is crucial for understanding the health risks associated with the chemical and implementing appropriate safety measures. Section 12. Ecological Information. This section outlines the potential environmental impacts of the chemical, detailing how it may affect ecosystems and wildlife. It includes information on the chemical's persistence and degradability in the environment, its potential to bioaccumulate in organisms, and its toxicity to aquatic life, birds, or plants. The section may also describe the chemical's mobility in soil and water, which can influence its spread and impact on different environmental compartments. Understanding these ecological effects is essential for assessing the chemical's environmental risk and ensuring proper measures are taken to prevent contamination and protect natural habitats. Section 13. Disposal Considerations. It provides guidance on the proper disposal methods for chemicals and their containers. This section outlines the safest practices for disposing of chemicals in a manner that minimizes environmental impact and complies with local, regional, and national regulations. It may include recommendations for the disposal of unused product, waste residues, and contaminated packaging. Additionally, it advises on the potential hazards of improper disposal and emphasizes the importance of following specific disposal procedures to prevent harm to human health and the environment. Section 14. Transportation Information. It provides critical details on how a chemical product should be safely transported. This section includes information such as the United Nations own number, proper shipping name, hazard classification, packing group, and any special precautions that need to be taken during transport. It is essential for ensuring that the chemical is handled correctly during transit to prevent accidents or spills. Additionally, this section may include specific regulations related to transportation by road, rail, sea, or air, helping to ensure compliance with international and local transport laws. Section 14. Transportation Information provides critical details on how a chemical product should be safely transported. Section 16. Other Information. It provides any additional details that are not covered in the previous sections but are important for the safe handling and use of the chemical product. This section often includes the date of the latest revision of the SDS, which helps users know how current the information is. It may also provide a key or legend to abbreviations and acronyms used throughout the SDS, references to relevant literature or guidelines, and any disclaimers or additional safety notes. Section 16 ensures that all essential information, even if not directly related to the chemical's properties or hazards, is available to the user for informed and safe practices. Important sections. These are the key sections to focus on during spill or before use. Section 1. Identification. Product identifier. Section 2. Composition and information on ingredients. Section 3. Hazards identifications. Section 4. First aid measures. Section 5. Firefighting measures. Section 6. Accidental release measures. Section 7. Handling and storage. Section 8. Exposure controls/personal protection. Section 9. Physical and chemical properties. Section 10. Stability and reactivity. Section 11. Toxicological information. Chemical spill management. What is a chemical spill? A chemical spill is an accidental release of a hazardous substance which can pose risks to health, safety, and the environment. Types of chemical spills. Chemical spills can be classified into two categories based on the severity and risk involved. 1. Minor chemical spill. 2. Major chemical spill. What is a minor chemical spill? A minor chemical spill is generally defined as one involving a small quantity of hazardous material, typically under 1000 cubic centimeters cc or 1 liter. What is major chemical spill? A major chemical spill is generally defined as one involving a larger quantity of hazardous material, typically over 1000 cubic centimeters cc or 1 liter. What will be the response on chemical spill? Minor chemical spill. Trained personnel can handle the cleanup using basic spill kits and personal protective equipment, PPE. Evacuation is usually unnecessary, and the spill can be managed quickly and safely without requiring external emergency response teams. Major chemical spill requires immediate evacuation of the area and activation of emergency code orange. Wait for the emergency response group. About chemical spill kits. We have two types of chemical spill kits. 1. Reusable type. 2. Use and throw type. All over the hospital, the chemical spill kits are available. 1. All inpatient departments. 2. All critical departments. 3. Specific areas of the outpatient departments. 4. Required non-medical departments and paramedical departments. Reusable chemical spill kit components. 1. Sodium bicarbonate neutralizer, 10 kilograms. 2. Sand absorbent, 10 kilograms. 3. Face shield. 4. Nose mask. 5. Heavy rubber hand gloves. 6. Apron. 7. Plastic dustpan and scoop. 8. Plastic bags, yellow. 9. Chemical hazard barricading tape. Use and throw type chemical spill kit components. 1. Absorbent pad. 2. Absorbent socks. 3. Face shield. 4. Nose mask. 5. Rubber hand gloves. 6. Apron. 7. Plastic bags, yellow. 8. Chemical hazard barricading tape. How to deal with minor chemical spill? Immediately alert the nearby persons and cordon off the affected area with barricade tape and identify the chemical. Refer MSDS, check nature of the spillage, chemical, locate spill kit, and choose appropriate PP, face shield, impervious gloves, nose mask, apron, shoe covers, etc. Pour sand or socks gently around the spill, then sprinkle sodium bicarbonate, neutralizer, or cover by the absorbent pad liberally over the spill. When spilled materials have been absorbed, use brush and scoop to place in an appropriate plastic bag and keep identification label. Remove contaminated PPE, then keep an appropriate plastic bag. Complete OVR by first person who have been identified. How to deal with major chemical spill? Alert others in the immediate area to evacuate. Leave the immediate area. Do not step in the spilled material. Close doors. Post signs as necessary. Restrict access to affected area. Allow no one to enter unless they have been trained to clean up spills. Remove injured person from exposure, if safe to do so. If splashed with a hazardous material, flush skin/eyes with water for 15 minutes. Send exposed person to staff health clinic or the emergency room for medical evaluation. If not immediately known, either 1. Check the label from a safe distance, or 2. Refer to MSDS. Dial 2222 and report chemical spill. Code orange. Provide information as requested. Wait for a return call from hazardous material spill response team. Provide information as requested persons knowledgeable of incident and / or the affected area at a safe distance. To assist emergency personnel, notify head of department or supervisor. Make a detailed OVR. Hazardous material spill response team. Safety officer, team leader, infection control practitioner, housekeeping supervisor, hazard waste supervisor, safe handling and storage of hazmat. Store flammable materials away from heat sources. Separate incompatible materials. Store hazardous materials in designated locations. Materials are stored in cabinets when the volume and hazard requires that special precautions be taken. Store in a cool, dry area. Keep chemical containers closed always when not in use. What are the staff responsibilities? 1. Identify hazardous material by reading MSDS, labels and signs. 2. Comply with labeling and other procedures as specified. 3. Use protective equipment when needed. 4. Attend training as required. Report unsafe conditions to the in-charge. What are the charge nurse or in-charge responsibilities? Identify hazardous materials that are used in the department and make inventory. Train new employees on job hazards and appropriate work practices to minimize exposures before assigning an employee to a job. Ensure that employees follow safe work practices. Hazardous materials labeling. 1. Labeling of hazmat is a communication method. First labeling standard is for the companies who is making the product. It is called GHS pictograms. 2. Second labeling method is an FPA Diamond NFPA 704. All the departments in the hospital have to follow this standard, as well as it is a CBHI standard. GHS pictograms. Exploding bomb indicates explosives, self-reactive substances, and organic peroxides. Flame signifies flammable gases, liquids, solids, and self-heating substances. Flame over circle represents oxidizing substances and peroxides that can cause or intensify fires. Gas cylinder indicates gases under pressure, such as compressed, liquefied, or dissolved gases. Corrosion, used for chemicals that can cause skin corrosion, eye damage, or metal corrosion. Skull and crossbones denotes acute toxicity, indicating that exposure to the substance could be fatal or toxic. Health hazard represents substances that may cause long-term health effects, such as carcinogens or respiratory sensitizers. Exclamation mark, used for less severe health hazards like skin or eye irritation, skin sensitization, or narcotic effects. Environment indicates environmental toxicity, particularly aquatic toxicity. The NFPA, National Fire Protection Association, Diamond, also known as the NFPA 704 Diamond, is a standardized label used to identify the hazards associated with various materials. The diamond is divided into 4 color-coded sections, each representing a different type of hazard. 1. Blue, health hazard, position, left quadrant description, indicates the level of health risk posed by the substance. The higher the number, the more dangerous the material. Rating scale 0, no hazard. 1, slightly hazardous. 2, hazardous. 3, extreme danger. 4, deadly. 2, red, flammability hazard. Position, top quadrant description, indicates the material's susceptibility to burning. The higher the number, the more flammable the substance. Rating scale 0, will not burn. 1, must be preheated to burn. 2, ignites if moderately heated. 3, ignites at normal temperatures. 4, extremely flammable. 3, yellow, reactivity hazard. Position, right quadrant description, represents the material's reactivity or stability. The higher the number, the more reactive or unstable the substance. Rating scale 0, stable. 1, unstable if heated. 2, violent chemical change. 3, shock or heat may detonate. 4, may detonate. Next, 4. White, special hazards. Position, bottom quadrant description, contains special codes to indicate specific hazards. These are typically symbols or abbreviations. Common symbols: OX, oxidizer, increases fire intensity. W, water reactive, reacts with water in a dangerous manner. SAW, simple asphyxiant gas. The NFPA Diamond provides a quick and effective way for first responders and others to assess the risks associated with a particular material at a glance. In conclusion, chemical safety in hospitals is crucial to ensuring a safe environment for patients, staff, and visitors. Hospitals often use a variety of chemicals, ranging from cleaning agents to medications and laboratory reagents, all of which can pose significant risks if not managed properly. To mitigate these risks, it is essential to implement strict protocols for the storage, handling, and disposal of chemicals, along with thorough training for all staff members. Key safety practices include proper labeling, such as the NFPA Diamond, the use of appropriate personal protective equipment, PPE, regular safety drills, and clear communication about potential hazards. By fostering a culture of safety and vigilance, hospitals can minimize the potential dangers associated with chemical use, protecting both human health and the environment. Thanks for your time. This is Engineer Geo signing off.